Hello and welcome to the Neurology channel. Today, we're going to delve into a topic that's crucial for understanding stroke risks: transient ischemic attacks, or TIAs. First off, what exactly is a TIA? Well, think of it as a warning sign from your body. It occurs when there's a temporary disruption in blood flow to a part of the brain, often lasting only a few minutes. This disruption is usually caused by a blood clot, similar to what happens during a stroke. However, in a TIA, the clot is small and temporary, allowing normal blood flow to resume relatively quickly. Now, you might be wondering, if the symptoms of a TIA go away on their own, why is it such a big deal? Well, here's the thing. Having a TIA greatly increases your risk of having a full-blown stroke in the near future. In fact, studies suggest that about a third of people who experience a TIA will have a stroke within a year if they don't seek treatment or make necessary lifestyle changes. So, what are the symptoms of a TIA? Transient Ischemic Attack, TIA, is a temporary disruption of blood flow to a part of the brain, typically lasting only a few minutes. Despite being transient, TIAs are critical warning signs of potential stroke risk and should not be ignored. The symptoms of a TIA can vary depending on which part of the brain is affected, but common signs include sudden weakness or numbness. This symptom often occurs on one side of the body, affecting the face, arm, or leg. It may manifest as a sudden feeling of weakness, numbness, or paralysis, making it difficult to move or control the affected body part. Difficulty speaking. Some individuals may experience slurred speech or difficulty finding the right words. This symptom, known as aphasia, can range from mild to severe and may be accompanied by confusion or trouble understanding others. Vision changes. Blurred vision, double vision, diplopia, or temporary loss of vision in one or both eyes can occur during a TIA. Visual disturbances may affect one's ability to see clearly and navigate the environment safely. Dizziness or loss of balance. Feeling lightheaded, dizzy, or experiencing a sensation of spinning, vertigo, can be symptoms of a TIA. Some individuals may also have difficulty maintaining balance or coordination, leading to unsteadiness or even falls. Sudden, severe headache. While less common, a sudden and severe headache can occur during a TIA, particularly if the disruption in blood flow affects certain areas of the brain. This headache may be different from usual headaches and may be accompanied by other neurological symptoms. It's important to note that the symptoms of a TIA typically resolve within a short period, often within minutes to hours, and individuals may return to their normal activities afterward. However, even though the symptoms are temporary, TIAs are serious medical emergencies that require prompt evaluation and treatment. Ignoring the warning signs of a TIA can significantly increase the risk of experiencing a full-blown stroke in the future. If you or someone you know experiences any symptoms suggestive of a TIA, it's crucial to seek immediate medical attention. Time is of the essence when it comes to preventing stroke-related complications, and prompt treatment can help minimize the risk of long-term disability or death. Now let's talk about prevention. Managing risk factors such as high blood pressure, high cholesterol, diabetes, and smoking can significantly reduce your chances of experiencing a TIA or stroke. Preventing transient ischemic attacks, TIAs, involves addressing the underlying risk factors and adopting healthy lifestyle habits to reduce the likelihood of experiencing a TIA or a subsequent stroke. Here are several strategies for TIA prevention. Manage hypertension, high blood pressure. High blood pressure is a major risk factor for TIAs and strokes. Monitoring blood pressure regularly and following recommendations from healthcare providers to maintain healthy blood pressure levels through lifestyle modifications, and, if necessary, medications can significantly reduce the risk of TIAs. Control cholesterol levels. High levels of cholesterol, particularly low-density lipoprotein, LDL cholesterol or bad cholesterol, can contribute to the formation of plaques in blood vessels, increasing the risk of TIAs and strokes. Eating a heart-healthy diet low in saturated and trans fats, exercising regularly, and taking prescribed cholesterol-lowering medications if needed can help manage cholesterol levels. Manage diabetes. Individuals with diabetes are at higher risk of TIAs and strokes due to the potential damage to blood vessels caused by high blood sugar levels over time. Maintaining tight control of blood sugar levels through diet, exercise, medications, and regular monitoring is essential for preventing complications. Quit smoking. Smoking cigarettes significantly increases the risk of TIAs and strokes by damaging blood vessels, promoting the formation of blood clots, and reducing oxygen delivery to the brain. Quitting smoking is one of the most important steps individuals can take to reduce their risk of TIAs and improve overall health. Adopt a healthy diet, eating a balanced diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats can help lower the risk of TIAs and strokes. Avoiding excessive consumption of salt, sugar, processed foods, and unhealthy fats is essential for maintaining cardiovascular health. Engage in regular physical activity. Regular exercise helps improve cardiovascular health, lower blood pressure, control cholesterol levels, and manage weight, all of which contribute to reducing the risk of TIAs and strokes. Aim for at least 150 minutes of moderate intensity aerobic activity or 75 minutes of vigorous intensity aerobic activity per week, along with muscle strengthening activities on 2 or more days per week. Limit alcohol intake. Excessive alcohol consumption can raise blood pressure and contribute to other risk factors for TIAs and strokes. Moderating alcohol intake or avoiding alcohol altogether is recommended to maintain cardiovascular health. Take medications as prescribed. If prescribed by a healthcare provider, taking medications such as antiplatelet drugs, e.g. aspirin, clopidogrel, or anticoagulants, e.g. warfarin, apixaban, as directed can help prevent blood clots and reduce the risk of TIAs and strokes in individuals at high risk. Manage stress. Chronic stress can contribute to high blood pressure and other cardiovascular risk factors. Practicing stress reduction techniques such as mindfulness meditation, deep breathing exercises, yoga, or engaging in hobbies and activities that promote relaxation can help manage stress levels and improve overall well-being. Attend regular checkups. Regular visits to healthcare providers for routine screenings and checkups are important for monitoring blood pressure, cholesterol levels, blood sugar levels, and other risk factors for TIAs and strokes. Healthcare providers can provide personalized recommendations and interventions to reduce the risk of cardiovascular events. By implementing these preventive measures and making healthy lifestyle choices, individuals can significantly reduce their risk of experiencing TIAs and strokes and promote long-term brain health and overall well-being. It's essential to consult with healthcare providers for personalized advice and guidance on TIA prevention strategies based on individual risk factors and medical history. Lastly, if you've had a TIA, your doctor may recommend medications such as antiplatelet drugs or blood thinners to help prevent future clotting episodes. Antiplatelet drugs and blood thinners are commonly used medications for preventing blood clots and reducing the risk of transient ischemic attacks, TIAs, and strokes. Antiplatelet drugs. Antiplatelet medications work by inhibiting the aggregation of platelets, the blood cells responsible for clot formation. By preventing platelets from sticking together, these drugs reduce the risk of blood clots forming in the arteries and blocking blood flow to the brain, which can lead to TIAs or strokes. Commonly used antiplatelet drugs include aspirin. Aspirin is one of the most widely prescribed antiplatelet medications for TIA prevention. It inhibits the enzyme cyclooxygenase, thereby reducing the production of thromboxane A2, a substance that promotes platelet aggregation. Low-dose aspirin is often recommended for long-term use in individuals at high risk of TIAs or strokes. Clopidogrel, Plavix. Clopidogrel is another antiplatelet drug commonly used in combination with aspirin or as an alternative for individuals who cannot tolerate aspirin. It works by blocking the P2Y12 adenosine diphosphate, ADP receptor on platelets, thereby preventing platelet activation and aggregation. Ticagrelor, Brilinta. Ticagrelor is a newer antiplatelet medication that also inhibits the P2Y12 ADP receptor on platelets. It is often used in combination with aspirin for the prevention of cardiovascular events, including TIAs and strokes. Anticoagulants, blood thinners. Anticoagulant medications, often referred to as blood thinners, work by interfering with the blood clotting process, thereby reducing the risk of blood clots forming in the bloodstream. Unlike antiplatelet drugs, which primarily target platelet aggregation, anticoagulants inhibit the activity of clotting factors in the blood. Commonly used anticoagulant medications include warfarin, Coumadin. Warfarin is a vitamin K antagonist that interferes with the synthesis of clotting factors in the liver. It requires regular monitoring of the International Normalized Ratio, INR, to ensure that the blood's clotting ability remains within the desired range. Warfarin is often prescribed for individuals with specific conditions, such as atrial fibrillation, that increase the risk of stroke. Direct oral anticoagulants, DOACs including dabigatran, Pradaxa, rivaroxaban, Xarelto, apixaban, Eliquis, are newer anticoagulant medications that directly target specific clotting factors in the blood, such as thrombin or factor Xa. Unlike warfarin, DOACs do not require frequent monitoring of INR levels and have more predictable anticoagulant effects. When considering the use of antiplatelet drugs or anticoagulants for TIA prevention, healthcare providers carefully assess individual risk factors, medical history, and the potential benefits and risks of treatment. Factors such as age, presence of other medical conditions, e.g., atrial fibrillation, bleeding disorders, and concomitant use of other medications may influence the choice of antithrombotic therapy. It's important for individuals prescribed antiplatelet drugs or anticoagulants for TIA prevention to adhere to their treatment regimen and follow healthcare providers' recommendations closely. Additionally, regular follow-up appointments and monitoring are essential to ensure the effectiveness and safety of antithrombotic therapy and to make any necessary adjustments to the treatment plan. Remember, knowledge is power when it comes to your health. By understanding TIAs and taking proactive steps to reduce your risk, you can safeguard yourself against the devastating effects of stroke. Thank you for joining us today on the Neurology channel. Stay tuned for more informative videos on brain health and neurological conditions. Until next time, take care and stay healthy.